I'm very fortunate that my practice is entirely cosmetic dermatology. A lot of my colleagues who also perform cosmetic dermatology um, don't get to dedicate their entire time to that. Most cosmetic dermatologists are also treating diseases of the skin. In my case, fortunately, I can dedicate my full time to addressing beauty needs, addressing whatever patients need in terms of their appearance, in terms of improving their skin. So I have very unique practice. There's probably not too many in the entire country that have a practice that has this particular full-time dedication and specialization. I'd also like to just briefly make an introduction regarding my products. Um, this was a line that I did a lot of research on prior to the development and launch. I'm happy to say that my products have an antioxidant derived from the red mangrove plant that no other product line has. And the key to this, of course, is that the extract from the plant has a higher vitamin C, has a higher potency, antioxidant potency than even vitamin C. So this is very exciting. And of course, the idea is we want to protect the skin and we want to keep it from aging as much as possible. So again, I have the only product line that contains this particular ingredient, which I have a patent pending on. Of course, the line has a lot of other excellent ingredients as well, including very key brown algae. The phlorotannins that are derived from brown algae have incredible anti-inflammatory, antioxidant properties. And in addition, they even stimulate the production of a protein in the skin that's responsible for protection of the telomere, which is a portion of the gene, the DNA, that we need for longevity in the skin cells. So again, that's just a brief introduction to the product line. Again, there are 6 products within the line, 6 SKUs, ranging from the cleanser to the hero product, which is the potent repair serum. Great. So I think you guys were given 2 of my 6 products. I believe you used the Hand and Body cream, which is fantastic. What I really like about this is that it's of the quality easily of a product that you would use on your face. I feel that a lot of times products that are used for the body, everybody sort of gives it the, oh, we'll just use these ingredients that nobody really cares or wants. Let's use all the cheap stuff. The Hand and Body, Renewing Hand and Body Cream has, of course, again, the red mangrove extract. It has, again, the brown algae extracts in it, as well as the Oxy Complex, which is a complex or a blend of 11 antioxidants and peptides and DNA repair ingredients that are very important. So the Renewing Hand and Body Cream is phenomenal in terms of its improvement of your body skin. Of course, you can use it décolleté, you can use it in the neck as well, and obviously the hand denotes, the back of the hands, where a lot of people are aging and nobody's thinking about what to do about that. The other product I believe that you all have is the Potent Repair Serum, and this is the hero product of the line, primarily because it is very potent, hence the name, and that's primarily because it has the highest concentrations of the red mangrove extract in addition to the brown algae extract. So the serum is a fantastic, phenomenal product, and you start to see improvements in the skin literally within a few days, and it just continues to improve after that. Of course, you're going to get improvement of skin texture, you're going to get improvement of the pores, lightening of the brown spots, etc. You're going to see this very quickly with the Potent Repair Serum. The other thing that's important about the serum, as you know, is a lot of people want a serum because they don't want something that's going to feel too greasy or oily. And the serum has a wonderful blend of moisturizing property and lightness and smoothness, and patients are extremely pleased with that.
Question.
How soon? Right. So in terms of the earlier question about how soon do we see firming effects, you can see firming effects basically with consistent use within a few days, because firming effects start with the return, replenishment of moisture and nutrients to the skin, the protection of the skin initiates a firming effect right there. And then, of course, you have the long-term effects with the peptides and the effects on collagen and so forth, and that's going to be a little bit more delayed. So that's going to be something within 1 to 2 months. But you will get some firming effects within literally days.
They pair with the serum in the cold weather.
Right.
What product?
In the cold weather, you're definitely going to need to use, you got to boost things up. So the Night Repair cream is an excellent product. It has some rich elements to it, which of course you're going to need if you have dry skin, and also if you're in very dry, arid, cold weather. So I would tell you that you should pair it up with the Night Repair cream. Obviously, it was designed and formulated for use at night, primarily to soothe and nourish your skin at night. But during really stressful, hard on your skin type situations like we have right now in the middle of the winter, I would pair it up with a Night Repair cream during the day.
If you want to talk about the other products that you have.
I saw the question. Yeah. Good.
But just go with the other product maybe, and then we'll go.
Yeah. So I've touched on some of the products. Of course, we touched on the two that you all have, the two products that you have. As far as the Day and Night Eye Complex, it's an excellent eye cream for two reasons. First of all, you have the same product that you get used twice a day. And if any of you have tried to treat the fine lines that are around your eyes, and this is primarily the eyelid area, but also the crow's feet, but primarily the eyelid skin, the fine lines there, you know that you really have to tackle it twice a day to get a really good effect. So for me, it was important to formulate a cream that you could use both during the day and night. So that's one of the main initial advantages to the eye complex or the cream. The other issue that's very important is it has hyaluronic acid in a certain way that's going to really get in there and hydrate your eyelid skin, because that's a tremendous issue with people, is they don't get enough hydration of their eyelid skin. Skin there is extremely thin, and you're just going to evaporate water off of the skin. As soon as that happens, you're going to see the fine lines again. So you have to deliver a tremendous amount of moisture to the eyelids. That's important. Yeah. All right, great. So the red mangrove versus vitamin C, or not versus, antioxidants are the mainstay. They're the first and most important defense for your skin against the aging process. As you guys probably know, the aging process is accelerated by oxidation, meaning a breakdown of the proteins, a breakdown of the cell membranes, a breakdown of our lipids. All the basic components are being broken down by the oxidation of those building blocks that create these, that form all the components of our skin. So antioxidants are a shield. So anytime that you can get an ingredient that's going to defend or protect or shield better than the gold standard, which is vitamin C, that's tremendous. And so that's the main issue there with the main plus with the red mangrove extract. It's not every day you come across something that actually has a much more potent effect than vitamin C.
At what age do you recommend something?
Yes. Anti-aging cleansers. It's a good question, because as far as age, I think for a while people were thinking of anti-aging products as, oh, this is for people who are getting old, this is for people in their 50s, 60s, whatever. More and more people are realizing that anti-aging products are all about your 20s, all about your 30s, because the point is to protect your skin before the changes start to occur. And the sooner you start to protect your skin And the sooner you can incorporate these important ingredients into your skin, the more you're going to simply delay that aging process. And it always works better from the standpoint of delaying or slowing down or retarding the aging process than it is from the standpoint of, oh, well, you know, your skin is pretty rough shape right now, so let's go ahead and start the anti-aging treatment and regimen. That's not what we want to do. So the anti-aging cleanser, I would argue that, you know, you should start that easily in your 20s. And in fact, I would say that for most patients, they should start using many of the anti-aging products even in their late 20s. Particularly those people who have, you know, fairer skin types who already have experienced quite a bit of sun damage in their life just from being fair and just the normal exposure issues that occur from life. Driving your car, being outdoors, walking from your car to your shop, you know, all those things that happen. You're getting bombarded by ultraviolet on a regular basis. Just a couple words on the night repair. The night repair cream is one of my big time favorites because it's so soothing and replenishing. It has just the right balance of moisturization for your skin. It's not overly greasy or it doesn't. It's not overwhelming, but yet it has a perfect balance. And of course, again, it has all the important ingredients that you need. The night repair cream is a phenomenal nighttime use. Coincidentally, someone had asked about the night repair, if it's good for all skin types. Probably the only skin type that you might be a little bit hesitant to use would be a younger acne type patient. Those patients tend to produce a tremendous amount of oil. The night repair cream might feel a bit on the heavy side for them, but for any patient with a normal to oily skin type, the night repair cream is a perfect fit. And we never talk about this, but of course, how much of a cream you apply is a big factor. You can have a cream that's very light, you have a cream that's very heavy, but of course you yourself can tailor the effects of that cream by how much you apply. So if you're a very dry skin person, you might apply a little bit more of a night repair, and if you're somebody who's more of a neutral skin type, maybe not too dry, not too oily, then you can apply a thinner layer. That's another way to basically customize that product for your skin. The serum can definitely be used in other areas besides your face, of course. You know, any of these products can be used in other areas besides your face. Again, it just depends on your basic skin tendency or type. For most people, the hand and body is going to do a tremendous job for your hand, for your décolleté, your neck, chest, etc. But you certainly can use the serum on the back of the hands. Most patients don't ask for that because they're perfectly happy with a formulation that's more on the cream base or sort of a heavier base. Most people prefer serum for their facial skin. They're concerned about breaking out. They're concerned about something being too occlusive on their skin. Crepiness is something that the hand repair cream is going to help tremendously, because crepiness first and foremost has to do with water loss from the epidermis, which is that top layer of your skin. We all have two basic layers to our skin. We have the epidermis and we have the dermis. The epidermis is the top layer. It's very, very thin. It has a dead skin cell covering. And then the dermis, of course, is the layer where we have the collagen and the elastic fibers. So the crepiness, the epidermis plays a big role with that. And we have damage to our skin cells on the epidermal layer. They're not functioning quite like they should, and you're getting water loss. So absolutely, crepiness is one of the things that the hand and body is going to help tremendously. Algae, again, I can't emphasize enough the importance of the brown algae in terms of how effective they are as antioxidants, how effective they are as anti-inflammatories. And when we say anti-inflammatory from a science perspective, we're really talking about a soothing property. And any of you who have studied or looked at aging skin, you know that the aging skin tends to be a little worked up. You know, you have red splotchiness, you have areas of spotted dryness. It's what we call inflamed. There are actually cells in that skin that are working overtime, and it's inflamed. So the brown algae are tremendous at calming or soothing, and that's a very important step in having your skin look uh, moist, dewy, supple, soft. So anti-inflammatory is a tremendous attribute of the brown algae, and again, the brown algae are literally functioning very much the way resveratrol does. It's pretty exciting that you can get a resveratrol effect from brown algae um, without resveratrol. So we have another mechanism, another way of getting into the DNA of the cell, getting into the genes of the cell to increase the longevity of the cells. Yeah. Scientific research involves two basic components always. Number one is the lab, if you will, or the academic side, meaning you have to look at a lot of the scientific work that's been done by others. You have to check the literature, as I like to do. I'm constantly looking at the scientific literature. So what's out there, what's been done, what have we learned about these ingredients, how were the studies done, how were they conducted, what conclusions can we make, what conclusions can we not make. So first and foremost, it's compiling a lot of information and data so that I can give it to you guys. I need to translate it for you guys, sift through the stuff that's not necessarily relevant, or sift through the stuff that's maybe a misinformation, not accurate. That's number one of the research. Number two of the research is plain and simple what we call clinical research, which is using these products on real people and making observations, using different equipment, different machines, not just our naked eye, which is tremendously important, but photography is important. We have different machines that can measure different components of the skin. So clinical and science, academic, both of those come together.
Do you do yourself?
Yeah, so sorry. So of course, yes, I'm doing this myself, and that's how we got to this point with this product line, is through basic research.
Can the foam repair serum be used?
Yeah, we actually use the potent repair serum. For example, our esthetician, after facial procedures, microdermabrasions, chemical peels, anytime that you are stripping the top dead layer of the skin is a little bit more sensitive, and that's a perfect reason to use the serum. Again, because of the calming, soothing effects. So yes, we routinely use the serum after a number of procedures. Any procedure that creates any break in that top dead layer of the skin, including from lasers, we use the serum. Okay, while we're waiting there for another question, yeah.
The ecological sourcing of the red mangrove.
Mm-hmm. Yeah, ecological sourcing of the red mangrove. One of the really exciting things that occurred with the discovery that I made of the red mangrove and its antioxidant effects was, well, I've now discovered this plant that has these phenomenal effects, but where do I get the plant from? You can find something, but nobody's farming red mangrove, and it's not readily available in some field somewhere. So how do we get around that? Well, fortunately, I was able to find a nursery, if you will, where they grow the seedlings of these red mangroves. And what's really neat about it is red mangroves are grown because we try to replant them in the coastal areas to improve the ecology of our coastal areas, because the red mangrove is essential for not just the health of marine species, because it's incredible how many marine species begin their lives their lives in and along the roots of the red mangroves. So not just for that purpose, but in addition to that, it protects the coastal areas from erosion and from pollution, and protects actually from storms and storm surge. So the red mangrove is an incredibly important ecological plant. Yeah. All these products are hypoallergenic, and there's two very good reasons for that. I mean, number one is, of course, I've used them on hundreds and hundreds of patients myself in the practice. And number two, I mentioned to you earlier again about the anti-inflammatory effects. When you formulate an anti-aging skincare line that includes the best of ingredients, the highest quality of ingredients, these ingredients are going to have a soothing and calming anti-inflammatory effect. And this correlates directly with being sort of the opposite of an allergic reaction, right? Or the opposite of allergic products. So this product line has ingredients in it that are calming and soothing. So no, we do not have any type of allergic issue. So yes, it is hypoallergenic. Okay.
She missed the word.
Yes, the telomere. Sorry, so I think someone might have been asking about the telomere. Telomere is a real hot subject right now in anti-aging. Right now, what's really exciting is what's going on with the DNA in our cells. And okay, now that we're protecting the cells from a number of different areas, okay, how about in the nucleus? How about where the DNA? How about where the genes are? What are we doing there? Because of course all the secrets are in the genes. So we do know from basic science that the telomere is a portion or a cap of protein that's on top of, at the ends of our genes or our chromosomes. And that cap is very important to protect the life of the chromosome, and that correlates directly with the age. So in other words, as our cells age, the telomere gets smaller and smaller, and that correlates with aging. So we want to use ingredients that protect the life of that telomere to then protect the life of the cell. These products are excellent for men as well as women. You know, men might tend to have, maybe there's a slightly higher percentage of men that may have a little bit more of an oilier skin type. But the products, you know, aging skin is aging skin, and we guys have to protect it as well. So absolutely, that's not a problem. You know, now that we're just sort of talking other things besides specifically the products, you know, exfoliation is very important. We want to stimulate cell renewal, and so there's a number of ways that you can exfoliate your skin. Of course, you can do it with glycolic acids, with retinol, with retin-A. So there's sort of a chemical way to do it. There's also exfoliation by light chemical peels, by microdermabrasion treatments. I know some patients use scrubs. I'm not a big fan of scrubs. I don't think they're as effective as primarily using ingredients that stimulate cell renewal. I think you get a much more consistent renewal effect. But those are the things that I believe in and recommend to patients, and I think are an additional important tool in anti-aging and getting your skin to look its best. SPF is a great topic. I love that one. Here's the deal with SPF. Remember that SPF is a measure, a rating system for sunburn protection. So I can give you an SPF sunscreen with a 50 SPF, but you may still notice that your brown spots are staying dark, or they're getting bigger, or maybe if you have melasma, you're noticing that your melasma is getting a little worse. So it's really about broad spectrum protection. So don't get fooled by the SPF rating. Right now we don't have a rating system for UVA, which is the other component of the ultraviolet spectrum. We don't have a rating system for that, so we can't tell you that, oh, this product has this much protection against UVA. But UVA, when we're talking about anti-aging, is more important than UVB or the burning rays, because most of us are interested in protection for our daily wear. We're not really thinking about sunscreen in terms of our recreational use. We want to protect our skin on a daily basis. So make sure that you use a sunscreen that is labeled broad spectrum. That means that they've shown in the lab that they're able to protect against the tanning or UVA rays as well as the UVB rays. Oh, and then of course, as far as what you should use during the day, if you use a broad spectrum SPF 15, SPF 20, you'll probably get as much protection as if you use a non-broad spectrum SPF 40 or 50. And the best way to tell, I always say to people, my patients, the skin never lies. So if you can see that your spottiness is improving, where you've done everything else the same, and the only thing you're doing is changing your sunscreen and you're getting a little more protection, that's a great indicator that that particular product is giving you more protection. My practice is basically primarily filler and Botox based, meaning, and when I say Botox, I'm using the generic term for Botox. I use a lot of Dysport. I've used a lot of Xeomin. We now have Botox, Dysport, and Xeomin. Those are the 3 neuromodulators. We can talk more about that if you want. But fillers is my main, what I do in my practice. So I do some laser procedures, but 95% of my practice is basically injecting the face, restoring the face. That's my main claim to fame, is let's restore your face. Let's not change your face. Let's not make you look different or odd. Let's just restore it. Let's get it back to where it was. And you can do some amazing things with filler in that department. Yeah, opening. The thing that's, I think, most exciting as far as new is that we're always using the cutting edge fillers. I'm actually right now doing a clinical trial in the use of Belotero, which is a new HA filler, hyaluronic acid gel filler, under the eyes. My area of subspecialty is injection of the hollows that are under the eyes. That's one of the first places of the face that starts to age. It's one of the first things that gives away your age. We started 25 years ago with fillers and just doing sort of the nasolabial folds, and that's important, but it's nowhere near as important as making sure that your eyes look refreshed and that you're not looking hollow or tired. So that's a clinical trial I'm doing right now with Belotero, which is a really neat HA filler. It kind of molds more than other HA fillers, so it's not like lumpy bumpy. It's more like it gives a smoother effect. Some of the other neat, exciting things is I'm using different types of needles, much smaller needles, very, very, very tiny micro needles, to fill the skin and try to create more firmness from a different angle than some of the other methods that I've used before. That's a great I love to talk about brown spots. That's an area that a lot of people don't understand. There's a lot of myths and misinformation about brown spots. The treatment that you do for brown spots will depend on how dark the brown spots are. So you might have somebody that's got very light smattering of brown spots and they still look spotty and it doesn't look good and they need to get rid of that. But that's a classic example where laser is not going to work. And they get their laser treatment, they go through the whole thing. It looks like maybe they're a little bit lightened up after the treatment, and then a week or two later they're right back. So the lighter colored brown spots, you either do chemical peels or you use a bleaching regimen, products to lighten them. Now when you get to the medium to darker brown spots, they respond very nicely to laser. Even then, most people have those plus some lighter ones. So you do the laser to get rid of the bulk of the dark stuff, and then a week later, you're either using a chemical peel or you're going to use maybe some lightening agents to try to further lighten the entire face. And then you have to, regardless, especially if you live down here, you're going to have to keep using some lightening creams and lightening agents to maintain that clear complexion. Oh, great. No, not at all. I am not anti-plastic surgery. I think most patients nowadays would rather try non-surgical options before they do surgery, because of course surgery involves some anesthesia risk, and surgery can involve some irreversible changes that once that's occurred, that's it. So most people are much more interested in, well, what can I do to look great but not take the risk of either sort of making myself come out or look irreversibly changed in a way that I wasn't happy with, that I'm not going to be happy with, or exposing myself to a health risk in terms of anesthesia and what surgery can sometimes do. So that being said, I think that plastic surgery is great and has a lot of uses. My favorite use or recommendation for plastic surgery involves the lower face, because we don't do as good a job with fillers on the what we call the jowls and the jawline and the neck area. So once the jawline and neck area starts to fall and get blurry and full, then really surgery is going to be a better option for you overall. Yeah, there's been a lot of controversy about hydroquinone, and this is because hydroquinone was sort of grandfathered in because it was such an old product. So it really got in the market, it really got in the prescription world before the FDA had an opportunity to, formally check it for its safe and effectiveness, as they do with all products before they can come to market. So hydroquinone was grandfathered in. So they went back and said, well, let's look at hydroquinone, and this was done five or more years ago. I can't remember exactly when, but it was done with the thought process of, well, nonetheless, let's do a toxicity study on it. Let's see what's going on. Is there anything we need to be concerned about? And there's really very little data that would support any real problem with hydroquinone. There were a number of studies that were done in laboratory animals, but those studies were done with incredibly huge doses of hydroquinone, and primarily where it's being given orally. The rats taking in gallons of hydroquinone. I mean, it's just crazy kind of how these studies were done. Nonetheless, we're always searching for non-hydroquinone based bleaching agents that could potentially be more natural, but as effective. Up to now, it's been really hard to find non-hydroquinone ingredients that are anywhere near as effective. But I'm working on that, and I've got a fading cream coming out in the near future that I think will work real well. Yeah, my products are currently available online. HeviaMDSkinScience.com, and so you can order them directly online, or of course if you go on my website, you can order them through my website. You'll have the link there from my website to get them that way, and of course I have them here. I want to thank everyone for coming, and again, I'm sorry I didn't get to meet you guys. It would have been nice to meet you in person. I'm sorry I can't see your faces now, but thanks again for taking the time to meet with me. And of course, please feel free to contact me if you have any questions, if you need anything directly.